So uh, that was really candid, and maybe we can go into the ways of treating it. No, maybe by it, is it can we just treat it by self-help, or PTSD has gone to a level where it has to have a professional intervention?
Now, when it is at PTSD, it has the diagnosis of PTSD means that this person's daily functioning has been affected.
Mm-hmm.
That just what I've talked about the symptoms, this person is daily thinking, having flashbacks. So they sit down, they're having flashbacks. They're probably even I can imagine people who went through the attack at Dusit, and
Yeah.
that's their place of work, and they have to go there every day. Can imagine what that does to them, brings back the hypervigilance, you feel unsettled and things like that.
Mm-hmm.
So when it gets to a point where, yes, there's a diagnosis, and yes, there's an effect on the daily functioning. The person can't function as normal as they used to anymore. Then that there is the option of therapy,
Mm-hmm.
which is key. However, again, if you notice that the symptoms are too severe, it is important to actually get psychiatric review so to get some medication to help in easing the symptoms,
Okay.
because it can actually even develop to other comorbid disorders.
Uh,
PTSD has other disorders that is closely related to, so it can even lead to, it's very easy for someone who has PTSD to have depression.
yeah.
Very easy for someone who has PTSD to develop a substance abuse disorder, because
Mm-hmm.
they're trying to numb the pain and the flashbacks and the lack of sleep. So you can imagine what that is doing to the mind and the body.
So it's
And
like PTSD just opens a Pandora's box and leaves you, vulnerable to all these other mental health issues.
I wouldn't say that,
Mm.
because it is not a must, or it's not that if you have PTSD you will get,
Mm-hmm.
but there is a chance, there's a likelihood, because we call them comorbid disorders, the disorders that are related. It's like when you have, I'm trying to look at it from the medical point of view, or I'm thinking, what disease can you have that can lead to the other?
Okay.
I don't know, but you get, there are that
Like
may.
it's like having HIV and then getting AIDS eventually.
No. That okay, yeah, it might develop, but if you
Yeah.
manage to take ARVs well, it means you're able to maintain the viral load to zero, and you don't have to develop to, you know, what causes AIDS is the opportunistic diseases.
Okay.
So in this case, yes, it may lead to depression,
Mm-hmm.
but not always. But when you hear someone with PTSD, you quickly assess for depression, quickly assess for substance use disorder, quickly assess for other things, because it may not come out as strong as this is clearly PTSD. Because someone might have actually, the mind could have unconsciously blocked so that you don't necessarily know.
Okay.
Yeah.
And what about? Can you briefly talk about spiritual intervention as a method of healing?
Yes, I can definitely talk about that. It is it is very encouraged. Encouraged. But this is, I want to put a disclaimer there.
Mm-hmm.
I know there has been a lot of discussion around Christianity or religion and mental health, and the
Mm-hmm.
line and the thin line. Is it a witchcraft issue? Do we go and pray and lay hands? Or
Yeah.
is it a psychiatric issue? Do we go for diagnosis? And there's a very thin line. But
Okay.
when it comes to intervention,
Mm-hmm.
if you as an individual, this is what I would say, if you as an individual do have a relationship, and since I'm talking from the perspective of a Christian university with God,
Yes.
it means that this is your source of strength. This is your source. This is, you go back to Him when you need help. You go back to Him when you need to be at rest, and you know how to do that. It could be a very good intervention. Definitely praying, meditating, having other people around you, which is a very huge fellowship, a very huge aspect of Christianity. And even reading the Word can have a very calming effect. But then again, this is what I said earlier. If it is affecting PTSD, has gotten to a point where it's affecting your normal functioning, it means even sometimes praying can be hard.
Yeah.
It means even sometimes seeing believers who all the time are coming to tell you it shall be well, the Lord be with you. But they don't know what demons you're fighting inside because of what you've gone through. So sometimes it can be a deterrent. But it is very highly encouraged. But again, also seek help,
Okay.
seek therapeutic intervention. I think it's good to have a biological, psychological, social, and spiritual approach. So we call it a biopsychosocial spiritual model.
Okay.
So even me, as a therapist, if I'm taking someone through it, I'll go through the biological way. Does this person need any medical intervention? Then now psychological way, where we use different therapeutic techniques to help this person to overcome.
Okay.
Then social, very important. Social, you have the support system, because who is going to support this person through it?
Yes.
What relationships does this person have? Is it a family? Is it friends? Because they come in handy in the recovery process. Then now spiritual, what you talked about, does this person have a relationship with God? Do they
Yes.
know how to, is it something they've used before? And if not, can it be introduced? So it's really good to have that huge biopsychosocial spiritual model when you're dealing with all mental disorders.
Okay.
Yeah.
Thank you. That's really candid. So let's
Yeah.
talk about COVID-19. Is
Mm-hmm.
COVID-19 a potential cause for
Mm-hmm.
PTSD for people, maybe directly
Mm-hmm.
or indirectly? Because I know directly, maybe the people who had family members who have been affected by COVID-19 or even unfortunately died,
Mm,
they are possible candidates of PTSD. But what about
mm,
everybody else who is just experiencing it on a secondary level?
yeah. I like what you said. It can be a potential cause because let me look at it in two different ways. Probably someone who had undergone trauma before, um, a traumatic event, and whatever is happening around, or maybe you find that someone within their estate or within their court was picked up. You know those ambulances that come and pull are dressed like they're going to space,
Yes.
and they're coming to just pick people. So probably such an occurrence might trigger anxiety, might trigger the same feelings that this person had when they underwent the traumatic event. I was reading a while back, I was reading an article about just the same thing. And they were talking about someone who, now this was in the States, this was just a journal entry. And they're talking about a lady who was there during the 9/11, the terrorist attack in the September, 9/11. So this person did witness and saw what had happened. And when this period of COVID-19 started, this person was actually in New York, and they were actually locked down. They started experiencing those similar um, feelings that that she experienced during the 9/11, and the anxiety came back, the worry came back, the flashbacks came back. So she's like, she was now going back to an earlier state of being traumatized. Now,
Yeah.
if that is not dealt with and continues for a while, and you see that's not direct, it's indirect. It's indirect exposure. It might lead to PTSD. Now, in our context, we have had the cases of a lot of gender-based violence rise in homes. And I think I was listening to the news, I think around a month ago, and they were saying not even a month, I think this week it was mentioned in the news, that a lot of children are being abused. Abuse in itself is a traumatic event,
Yeah.
which could develop into PTSD. And this has happened because now people are more home together. People are not used to staying home together. There's a lot of friction.
Yes.
Um, I was reading another article, and I think it was a wife talking about the husband, and she was saying, I'm not used to having him here. I mean, he leaves very early in the morning and he comes back very late. And I think the lady used to work a night shift.
Yeah.
So when the husband is coming home, she's gone to work. So
Yes.
they can almost, as they were saying, the only time they're used to seeing each other is Sunday afternoon,
Mm-hmm.
you know. So you can imagine such people who've not lived together for long, and they've lived together for long, but they have not gotten used to interaction.
Mm-hmm.
And now they're interacting on a daily basis with very minimal resources. I mean, a lot of frustration can get, and this can be translated to abuse. And abuse is a a traumatic event, which could, not always, but might lead to post-traumatic stress disorder. The diagnosis of COVID itself, I mean, if you have family members, that especially among children, that being pulled away from people that you love. I was hearing of an incident that happened, and I think they were separated. You find that children are being put in a different isolation facility, and the mom is in a different isolation facility. You can imagine that it's almost traumatic because of separation and you don't know where you're going. There's a lot of uncertainty. Does it mean I'm going to die? Because also something about post-traumatic stress disorder is that there's that threatened, they call it threatened death, threaten serious injury that could actually lead some of this. So yes, COVID could be a potential cause
Okay.
of post-traumatic stress disorder. For people who've had traumatic exposures before, definitely. Then others who could be ongoing. And now the whole COVID situation and the anxiety that comes with it, and the uncertainty that comes with it as well.
Okay. So maybe
Mm.
maybe I can just touch on that as I go to my last question. Do you think
Mm-hmm.
rather is domestic violence
Mm-hmm.
a cause of PTSD to children who are watching the violence happening in their homes?
Mm.
And then after
Okay.
that, after you answer that question, also please answer
Mm-hmm.
whether you have now
Mm.
interacted with these children in schools, like for example, Daystar University where you work.
Mm.
Have you
Mm.
interacted with kids who have been subject to post-traumatic stress disorder, which is stemming from their homes, and how is it affecting them in their school social life?
Okay. So the first one is whether domestic violence can be a cause of PTSD, especially among children who watch.
Yes.
And I would say yes, it could be. You remember we said traumatic exposure doesn't automatically equal to PTSD.
Mhm.
So one person might develop, the other person may not develop, but it is a potential cause. So of course, when you're witnessing, um, we said you get PTSD from either you experiencing or witnessing. So imagine this child is witnessing either the mom being beaten, or even now men are being abused. So
Mhm.
imagine they're witnessing that physical, even verbal abuse, or even emotional and psychological abuse. So for them, it becomes like torture. So the memories are stuck because I'm sure they can hear either the voices or the things, they can hear the cry of one parent who's being abused, and this sticks with them. It's hard for them to remember. So every time they hear someone shouting, they startle, or they even start having nightmares, or still start having flashbacks about what has been happening at home. And if definitely that is not dealt with, it could lead to post-traumatic stress disorder. It
Okay.
definitely could lead, among many other disorders.
Uh,
Whether I have dealt with such cases, of course, I can't disclose much because someone can say, "Oh, she was talking about me." So, for ethical purposes and
yes.
confidentiality, I'll be as vague as I can and try to answer your question.
Yes. Yes.
So, encountering, yes, I have encountered. I won't say specifically at this because I
Mm.
don't think I should say that.
Okay.
um, but yes, there is a lot of out of domestic home abuse. Actually, someone who's now probably even as old as 20 remembers something that used to happen when they were a child,
Mm.
and you find that this person avoids. Um, people who look like the dad or people who resemble the dad, or you find that they're easily startled, they're always on the edge, they have flashbacks and they have had nightmares for the longest time, and
Yes.
probably they didn't know about it. And now they're coming because they're wondering, I can't concentrate. I sit in class, the only thing I see is that physical abuse. And also, just to broaden it a bit and just not about domestic violence in the home setup, even in campus, people have relationships, and you find that you're being abused in that relationship. There's sexual abuse, there's psychological abuse, there's verbal abuse, and that can also lead to post-traumatic stress disorder. So
Okay.
there are a lot of, as long as it's any traumatic event that threatens your wellness, mental, physical, emotional, it's definitely a potential cause of post-traumatic stress disorder. So we have some others are actually we didn't talk about the causes, yeah.
Oh yeah.
Yeah, we didn't talk about the causes, but
We've touched on them a little bit as we
yeah,
are
we have.
speaking. Yeah.
Yeah, we have. We have. So yeah, that's how I'll answer it. So yes, they're there, but luckily, I think the people I have encountered have not needed medication. So we worked it through in therapy.
Okay.
Yeah. But I think earlier, maybe my experience outside Daystar in an organization that I used to work before, I did meet some people who were actually very, very seriously traumatized. And I remember I was working with refugees a while back, like I think
Okay.
3 years ago. And I remember this lady telling her story. This is not it's not a story I had, so it was not in therapy. So
Okay.
I can close because it was in a book summarized about some experiences that people had. And this lady was from a country that was war torn, and she witnessed her husband and her son being killed, and they had to run out.
Oh, wow.
So there was a small child who was running, and there was one she was carrying. So they just stormed out and left. So when she's running in the forest and she's hearing the sound of a chicken, you know. So she's wondering, why am I hearing a chicken? Why am I hearing the sound of a chicken? Anyway, she continues because she knows these people could be following. So they're running with a kid, and the chicken is still making noise. So when they get somewhere, they stop. She actually realized that she carried her chicken, the chicken instead of her young child. So you can imagine by the time you're meeting such a person, the amount of trauma they
Wow.
have.
Yeah.
So the causes of trauma could be diverse. We can't say it's because of this or this or that.
Yeah.
But the most important thing, if you feel like you have such symptoms, please seek help because they're interfering with your daily functioning and you're not able to operate the way you're able to operate. Just come. For us, we have an assessment tool that we use. Of course, we have the manual, the diagnostic statistical manual that we use as therapists, as psychologists, to check whether this person fits. But also, we have assessment tools. First of all, to know the severity of the diagnosis, so that we know now, is this person a referral case or can this person go through therapy? But
Yes.
then I also need to emphasize that even if you go through the medical intervention, you go and get drugs, therapy is still important because what drugs do, they take away the symptoms. And
Okay.
I'm not against drugs, they are good because they help you relieve the symptoms and start working out the issue. But it's very important to go through therapy because then you deal with the cause of what brought the symptom and be
Oh,
able to come out of it. So
Philip, you
both
said
medical
something
and
important as
psychological.
well.
Yeah,
Yeah, you say something very important that the drugs take away the symptoms and don't
yeah,
necessarily deal with the core of the issue.
yeah, yes. Actually, they don't take away; they kind of manage so
Manage.
that you're able to think because sometimes the symptoms are too overwhelming. I
Yes.
mean, they're just too overwhelming. So they just need to be relieved, some symptomatic relief, sorry, so that you're able to now start thinking, allowing yourself to feel, allowing yourself to now go through the process of healing.
Okay.
But total healing comes from both. And
Okay.
again, remember the biopsychosocial spiritual model?
Yes.
All that is in the process of healing.
And I thought about talking about preventing PTSD, but thinking about it, there's no
Yeah.
way really you can prevent PTSD, because if it's a traumatic experience, it's not
Yeah.
something that you can all see coming, most of the times. It just happens.
Yes.
Yeah.
Yeah, it's actually a sudden event. You might not be able to prevent it, because you can't lock yourself in the house and say, okay, no, I'm not
Yeah.
exposing myself. But you can just watch something on the TV
Yeah.
and you become secondary traumatized. Or
Yeah.
your friend calls you and like, oh my goodness, guess what happened? Then what you hear
Mm.
causes the
Yeah.
traumatization. So it's different. Or even where you work, like for us as psychologists or therapists, we have to be very careful, because we hear a lot of traumatic stories.
Mhm.
So you can imagine, if I'm not very alert to practice self-care, to go for my own therapy. We actually do go for therapy. we are
Mm.
not we are not all what do you call it, at the hardcore. No, we
Yeah.
also need help. So if I don't take those precautions, then chances are I'll also end up in the same place. So I won't be of help. So yeah, you might not be able to lock yourself, because you can just experience it anywhere. But you can be aware
Mhm.
of its possibility of happening, and allow yourself to process and actually come out of it. For
Mm.
the first, after traumatic events, after shock, you see, your body goes through shock.
Mhm.
You've heard about the fight flight response, where you hear a loud bang and you see people moving. So all of a sudden you get this strength to jump over a wall. Then tomorrow you come and you're looking like, did I just jump through that wall?
Yeah.
But that's what happens. So you
Mm.
can't stop yourself, but just be aware that these things happen.
Yes.
And if you get to a point where you're not functioning, please seek help. It doesn't mean that you have the disorder that you're seeking help. It can actually help you to stop the development or the furtherance of the disorder.
Yeah.
Yeah.
Stopping a crack before building a wall. So
Yeah.
acceptance.
Actually fixing the crack,
Yeah.
because stopping it,
Of
it can always start again.
yeah. Okay.
Yeah, but I like that. True.
Sawa. So thanks a lot. That was a very, very candid discussion. Thanks for coming. Thanks for making time. Thanks for all the
Thank you.
tips and knowledge about it. And I
Yes.
believe a lot of people will be helped by watching
Yes.
this.
It
Sawa. Do
was
you
my
have any?
pleasure, Santi. Thank you for having me.
Uh-huh.
Please reach out. In case you're out there and you're struggling and you're not sure where you're at, just reach out. We're here for you. We'll listen. No judgment. We keep confidentiality. Just reach out.
Sawa.
Thank you, Brian.
Thanks a lot.
Okay.
Dear viewer back at home, thank you for coming to this week's DC3 Health Talk, and let's meet again next week for another candid discussion.
Thank you.